What are we starting this with?
An update on how a comment. An update on how many? Yes, an update on how many Spotify subscribers we have.
Yeah,
That's what I was going to say.
You've been hit
exactly those
15,000.
Oh yeah, we had to hit 15, right?
We had to hit. Yeah. What do you think? Did we?
15,001.
More.
Whoa, 15,002.
Slightly more.
15,100.
Well, that's closer. 15,255.
Yes!
Amazing,
Go, you
right?
guys.
Amazing.
Legends.
So many Spotify followers on Spotify. If you would like to be a follower on Spotify, follow us on Spotify.
If you
Now
don't,
we can continue the show. We don't have to quit.
if we don't hit 16k by the next time we do an update, Jamp will be sacrificed.
He will. Horribly.
So why is it always me?
You're the easy
pixies.
Neville, I'm really sorry about this.
We do have a question, though. We've got a little question for the people that are watching. So if you're on YouTube, go and answer this question in the comments. The question is, are you left-handed or right-handed? Just curious.
Corey wants to know who to block.
No. there's no more leftophobia on this.
That's
on
Creating a
this
safe
podcast.
space.
Left.
An
handed
echo
safe
chamber.
space.
Shall we start the show?
Let's start the show.
Will we ever say no?
Maybe.
We
One
make
day.
that joke like every 2 weeks. So,
Oh, okay.
Let's start the show.
no.
Hello and welcome to Sci Guys,
waiting
the
for
show
the-
where we bring you the craziest facts and science news.
This is
My
all
name's
wrong.
Corey, and as always,
Wrong.
I am Jamp and Luke Cutforth.
This week we're talking about extraterrestrial extremities.
Ooh.
What?
You know what an extremity is? On
Like
your
an
body?
arm?
Yeah.
Right.
Extraterrestrial, another word for that?
Alien hand arm syndrome.
Yes, alien hand syndrome.
That's it.
Wow.
Well done.
Cryptic crossword king over here.
So, what is alien hand syndrome? Do either of you know?
It
You
is.
grow a spontaneous alien hand grows from your body.
No.
That's it.
No.
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 Damn it.
When you feel like you don't have control over one of your limbs and it starts acting of its own accord.
Yeah, I mean, I think I'm gonna be very, very mean here. I would say feel like isn't necessarily the best way of describing it because you don't have control of one of your limbs, you know?
But what is you, Corey?
Oh, Luke, don't.
What are any of us?
We're like less than 5 minutes in.
No, I mean that. Like, what do you? Because, like, yeah, you as in the conscious.
Yeah.
You don't have conscious control over it. But then, as the arm got its own consciousness,
Well, clearly, yeah. Evidently.
that's freaky, man.
What?
But that's you as well.
No, well, I mean, we'll get.
It was once you, so
Yeah,
it's
but
like a
not
bit of
everything
you that
that-
split off.
But not everything that is me is always me. You know, like, I mean, every single time I pee, that's not me, is it?
But what I
I'm
mean
not
is
leaving
you.
me.
what I mean is, like, sorry to already take this into a weird direction, but like when you're having a dream, you're not doing any of the dream, but it is also kind of you because when you wake up, you know that your brain was doing the entire dream,
Yeah.
even though they felt like something separate to you.
Like every person in the dream.
Yeah.
Yeah, that isn't you. And though that is weird, though, right? That there are other people. Oh, it's weird that your brain can simulate other consciousnesses.
Last night, I had
Yeah.
an incredibly lucid dream, and I said to one of the members in my dream, "I'm having a dream. So what does that make you?" Like, and they were like, "Oh, I didn't think about what I was. I was just being me." It was really freaky. It was so freaky. And then I asked a kid in this dream, like, "What are you?" And they were like, "Oh, to be honest, I wasn't thinking at all." It was so weird.
And then they were ripped from
Like, why are
existence.
you doing this to people? In your, like,
it was
going
so
into your
weird.
dreams and just destroying someone's existence. That is
Well,
horrifying.
that's what you do every time you wake up. So, murderer.
Well, I wouldn't say the waking up is what makes me a murderer. If we look at last week's or 2 weeks ago's episode, it's what I do while I'm asleep that makes me a murderer.
Yes.
As in commit murder.
Yeah.
To clarify, that's a sleepwalking episode.
No.
Okay.
No clarification.
Just leave that in the air.
Listen-
Corey might murder sometimes.
Listen to the sleepwalking episode, and there's your clarification.
We live in fear.
You should sleep in fear. So, alien hand syndrome. It is a very rare thing. It doesn't happen very often. Basically, yeah, as Luke said, you don't control your limb. It moves involuntarily, and it doesn't feel like it's yours either when your hand is doing stuff. So if my hand was to come up and start doing this, it'd be like it feels similar to Luke's hand doing this to me. I'd be like, no.
Oh, I see.
I don't
Can we
want.
just fondle your face?
I'd rather you didn't.
Okay.
You can fondle Jap's face if you want.
No, don't give consent for me.
I've given your consent. That's all.
It's not me. It's my alien hand.
Ooh. Alien massage.
So yeah, it usually affects the hand, but it can also affect your leg as well.
Wow.
Yeah, imagine trying to walk with alien leg syndrome.
Doing a little dance.
Yeah, just kicking around.
Tarantalegra.
So, do you know when alien hand syndrome was first described?
Split brains.
That's not a time
In
or
Luke's
a date.
episode was the first mention of it ever.
Is it after patients had their brain split for epilepsy?
Well, I don't think so. Actually, it was it was first described in 1908 in a 57-year-old woman who
It was described
felt
inside her. Little doctor inside. Alien hand syndrome.
a 57-year-old woman came in with her left hand trying to grab her throat. She had to restrain it with her right, and yeah, so that was it was first described by a man named Goldstein, and it, throughout the 20th century, there were more people sort of coming forward to say, hey, my hand is doing its own thing. What's going on? And there were lots of different names that were given to it. We kind of settled on alien hand syndrome. There were other names like magnetic apraxia and all these different things. Another interesting one. You guys might have seen this film. Have you guys seen Dr. Strangelove or How I Learned to Stop Worrying and Love the Bomb?
Yes.
Oh, a long
Yeah.
time ago, yeah.
Yeah. Do you remember in that film how Dr. Strangelove, the eponymous character, has a hand which acts of its own accord?
Yes.
Yeah. So
Oh, yeah.
Dr. Strange, I think it's Dr. Strangelove or Strangelove syndrome was another.
Right.
Yeah, there was another name for it. Obviously, that was not the official name, but that's obviously what people would call
Refer
it.
to
because-
it, yeah.
refer to it as. But alien hand
to be
syndrome
fair,
is
there
the
are like medical things that have like Pikachu in the name, so that
Yeah.
wouldn't be too shocking.
Pikachurin, yeah,
Yeah.
or Sonic Hedgehog protein.
Yeah.
Yes, that's, yeah.
But I think that was changed because I think it's just Sonic
Too
Hedgehog
long.
protein because the gene
Oh,
because it's something to do with your eye. So I think it's something to do with retinoblastoma. So if you're telling a
Yeah.
parent, hey, your child has this awful aggressive eye cancer called Sonic Hedgehog, it's like, oh, you don't want to do
my
that.
leg.
No, that's just my alien hand.
Stop it.
Sorry.
Very good.
I have Dr.
And now
Strangelove
it's,
syndrome.
it's time for your diagnosis.
Yeah. So, so Luke, you mentioned split brains. So we've spoken about alien hand syndrome before, particularly in Luke's split brain episode. But I think what we've not gone into is that it's not just something that occurs when your brain is split. It can also come about due to strokes or neurodegenerative disorders. So in this woman's case, it was because she had they found out that she'd had strokes in her right hemisphere and also in the corpus callosum, that bit of your brain that connects basically the two hemispheres. Yeah. So any kind of damage to the sort of connections between the two hemispheres of your brain can result in this. And yeah, like I said, lots of people had it throughout the century. There were two patients in the 40s who had involuntary movement in their left hand after they had that split brain surgery that you spoke about, Luke. And the left hand was basically in those cases working against the right hand, like if the right hand did something, the left hand would try and undo it. It's like it had a mind of its own.
People were like they were trying to get dressed, and the other hand would disagree on what to wear and would try and take it off.
Yeah. So they called this diagnostic dyspraxia. And in the 50s, like I said, magnetic apraxia was the name. They used that to describe basically one hand groping and grasping things after a particular problem in the frontal lobe of the brain. And then in 1972, there was a French term. In English, the term is the sign of the foreign hand. In French, it's le signe de la main, hand.
That's much better.
No, that's head.
Étranger.
Oh.
Étranger. I don't know. I don't speak French.
Lingerie?
Lingerie?
Signal of the Alien
Ooh.
lingerie.
Ooh, alien lingerie. Very nice.
One hand puts it on, the other takes it off.
That would be if you were an exotic dancer or a stripper or whatever. That would be a very, very difficult disorder to deal with. You know.
Oh my God,
You need to go watch that on YouTube if you're listening to the podcast without video. What I
You need to
mean,
witness that.
when I say, like, I know it sounds like a kind of ooh thing, but when I say, like, what do you mean by you? What do you mean by, like, in the case of, like, for example, this very specific alien hand syndrome where the conscious individual has retained the faculties of everything else, but just the hand is acting out, then that's, like, one thing. But if you've had your brain split in half such that your two hemispheres can't communicate, then what it sounds like what you're describing there is when you're saying the person is the person who can talk to the doctor, because there's an entire other hemisphere that's just observing the world completely on its own, but can't necessarily
They
access
can't
the voice
talk,
box.
Yeah.
Well, I think the issue here is that also, if you think about it, the legs are still working and other parts of the body are still working. I think it's the brain is very complicated. So in some people that have had strokes and say the right hemisphere in the corpus callosum, there is an issue with transfer of information, but
Not completely.
not necessarily completely, and the body can still function in a sense, right? So yeah, I don't know if viewing it as always the outcome of a complete split it's basically splitting one consciousness into two is necessarily super scientifically accurate. I think that it's very complicated. Essentially, it's the brain. You know, we could ask any question, and inevitably you can ask someone that knows more and more and more about the brain, but inevitably you'll get to someone who's like, I don't know, I know the most about brains of anyone on the planet, and
most complex object in the known universe.
Yeah,
Human brain.
it's kind of. Well, I don't know if that's true.
I've read that before. That's.
I'm sure you've read that before, but who wrote that?
A human brain.
A brain wrote it.
True.
Yeah.
The arrogant of that brain.
Most self-centered objects in the known universe. I'll
So
tell you that.
It's the only thing that named itself.
Exactly.
Yeah.
Yeah. No.
Other
Except
than Madonna.
Pokemon.
Madonna named herself. Yeah.
Oh.
Yeah.
okay.
I think a few people have named themselves.
Johnny Vegas.
Alaska.
Anyone who's got a
In Looking
stage
for
name.
Alaska.
Yeah.
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 Wow.
Yeah,
Real person.
Jamp.
Thank you for shitting on my point.
Jam.
Oh my God, yeah, Jam. I did give that to myself. Well, actually, no. Other people started using it, and I just went with it.
Okay.
That's how. Yeah.
Fair enough. Okay. Well,
Slightly less cool, man.
I would stick with the cool story.
Peer
So-
pressure.
So those patients those patients that had the sign of the foreign hand, they had tumors in their corpus callosum, and they couldn't recognize their left arm when it was held by their right arm behind their back, and they couldn't sort of transfer. So it says here they couldn't transfer functions between the different hemispheres, so they couldn't movements and stuff between the different hemispheres. They couldn't transfer those, but they could still sort of there wasn't sensory loss.
They could
there.
still see out of both eyes.
Yeah, they could still see out of both eyes, and there weren't involuntary movements. They just couldn't make their sort of left arm do something across the hemisphere, essentially, if that makes sense.
Yeah.
And all of this stuff is very complicated. These are just sort of broad-ranging, different sort of case studies of alien hand syndrome. And apparently they noted this, that when the non-dominant hand, which was usually the left, was made to move due to some kind of conversation, like moving, having conversation, or when the right hand, the dominant hand, were to voluntarily move it, it starts to behave as foreign and performs simultaneous but conflicting actions during unilateral normal limb actions or bimanual tasks. So like tying your shoelaces or buttoning shirt or using a knife and fork. So if someone was to start gesticulating while they're talking or try and tie their shoelaces, their non-dominant hand, the one that was sort of experiencing sort of alien hand syndrome, would do actions at the same time that conflicted with what the right hand wanted to do. Kind of like what you were describing there, Luke, where one hand would say started button up a shirt while the other one was unbuttoning it because they couldn't agree on what to wear, sort of thing.
Almost sounds like, I mean, there's just in the description, maybe I'm reading this wrong, but it sounds almost like in that section, like the other hand is sort of almost correcting for what it's experiencing to be like an outside input. Almost like when you are at the edge of a cliff and you get this feeling that you want to go back, and then your brain overcorrects, feels like it's one of the descriptions I've heard as to why you get that feeling of like wanting to jump over a cliff is that some parts of your brain are going, whoa, that's a cliff, and trying to make you move backwards. And then another part of your brain is experiencing the want to move backwards and trying to overcorrect to get you to move forwards because it perceives that you're falling backwards. I don't know if that's actually the latest description of as to why, but that sounds like your one hand is going, why am I moving? And is trying to undo the movement that it doesn't perceive to be doing itself.
I mean, maybe this is the thing. I feel like what we'll say for fact, what we can say for fact is observation. This is what we observe. The hand does this. I feel like when we try to answer why, particularly with brain stuff, it becomes really complicated. So that could be the case,
Yes. Never take a story that I give you but the story is meant to help describe the data, not to be taken literally.
Yeah, yeah, exactly. So it's
as if this were the case.
Yeah, I feel like often when we talk, you us three, sort of, but we as a people talk about, say, oh, the hand does this because it wants this. A lot of people will take that very literally, like the hand literally has its own little brain and is deciding to do X, Y, Z. But we don't know that. What we can say is that observationally we see this behavior. But especially when it comes to the brain, trying to ascribe why that happens can be very difficult. And I mean, you can get why in a sort of smaller sense in that, okay, well, this happens because of this function in the brain or this structure, But when you start building a story out around it that, this hand is doing this because it wants that.
Sure.
It's just, it can be, that's much more difficult to sort of validate.
Yeah, that's a really interesting point, actually. Any story in that sense shouldn't, I think as a general rule, if you hear a story, it's to describe something in a way that your story-loving brain can process, as opposed to the story is actually true.
Yeah,
that's a good point for people to remember.
And this comes about, and this is the reason I bring this up is because I see this thing, and I know that you're doing this in a not malicious way at all, and it's not even a bad thing. It's more about the way that people understand things, and I see this on TikTok all the time, wherein people are telling science stories about sort of experiments and what the outcomes of them mean, and it's not people necessarily that you should trust. It's just some teenager, just some person who has maybe read a secondhand article about this and is now conveying it to their audience, or is even worse, seen someone else on TikTok talking about it and then done the same thing.
Yeah.
And this used to happen on Tumblr all the time as well. So essentially what will happen is someone that doesn't actually understand necessarily what they're talking about will start to like say, oh, this scientist did this experiment and that proved XYZ story. And people will understand the story as being the fact rather than the story as being like a way of
description mechanism.
Describing what was found. And I just think that it's really important to bring that up,
especially when they're influencers. Yeah, they can popularize stories really easily.
Yeah, and that's most of the sort of science facts you see on TikTok are just stories, and most of them aren't true because a lot of the science stories on TikTok are just based on either false experiments that never happened, or experiments that have been proven wrong, or like unrepeatable experiments. All of these things, like a lot of the science stuff you find on TikTok is rubbish.
I guess it's also partly something I've been thinking about recently a little bit, is it's partly like a product of our language where you have like nouns, verbs, and adjectives. So you have like this noun does this action, verb, to this other noun in a certain way. And that's quite a limiting, like nouns don't exist in nature at all. There aren't really nouns because every noun is made up of lots of other little nouns, is made up of lots of other little nouns. You're a person made up of lots of little cells, is made up of lots of little atoms, made up of lots of little quarks. And all those things are levels. They're not really real in like the most specific sense. They're made up of lots of little other things, and we probably may find out that those things are made up of little other things as well.
Yeah.
And so, it's a mixture of our brains love of stories, which we were talking about before, and it is helpful to describe something through a story, as long as you then go, and now that you've understood it, take the story away. The story is like a training wheel.
Yeah.
And then you go, but remember, the data is the observation is the only thing that we know to be real.
Absolutely. And I think the difficulty as well is that we like to anthropomorphize things. Like we'd like to give desires to. So we'll say an electron wants this.
Yeah.
And atoms want that, and this chemical wants to do this. When ultimately it doesn't want, it just does.
Yeah, language, even down to words, sometimes that has connotations that imply intent or something that is not there in nature. Yeah,
like Jamp smashed the glass.
Yeah,
doesn't matter if he did it by throwing it on the floor or an accident. Jamp smashed the glass.
Yeah, other languages have that though. Other languages have different modifiers that can tell you whether an action was done intentionally or accidentally.
Yeah,
which is really interesting.
We need that.
Yeah. Well, do we?
I think it would clear up a lot of things.
Yeah, I feel like the thing is, I think trying to get the most, I think all languages kind of work, right? We don't necessarily have a word to say there is intent, which leaves ambiguity, but we can show intent. We can say X accidentally did Y.
It's just awkward. It's like it's something you have to get used to. Like you have to say, "Oh, the glass was smashed." I think German might be quite good for that. I forget. Maybe someone German can comment and say, "I feel like maybe I've read somewhere that German is quite good for, the glass was smashed, and then you can add by this person or accidentally because this person did this thing, but it might not be German." So correct me, please. I crave it.
I think the thing is that we could try and get the most sort of specific language, but then that ambiguity in language kind of lets us have poetry and simile, the metaphor, and all of these different things. If you have a purely functional language that tries at its best to eliminate all ambiguity and describe the world as objectively as possible, well, one, it's going to be too large and unwieldy. It's just not going to work. And two, you're going to lose a lot in that language. Because you can't have there's no puns anymore.
Yeah.
No puns. Nothing like that,
Yeah. I guess all I mean is when it comes to teaching science though, it is a little bit of a barrier.
Yeah, that's
because you carry all of the hangovers of the language you're teaching in, and then you have to go around in a long-winded way to clarify all the things you've said because of the limitations of your language. And it's kind of frustrating.
Yeah, that is very true.
It could be useful for the training wheels aspect of understanding science, but some people get stuck there and it just leads to misunderstanding.
This is something I was thinking about recently that, well, for one thing, it's really difficult for me doing this show to try and figure out what is the baseline level of knowledge. And I did a video the other day where I spoke about gender and so many people commenting, there's only 2 genders, and then started talking about sex. And I'm like, oh yes, I assumed that the people watching would know that I am coming from a place of gender and sex being separate concepts.
Yeah.
But that you can...
Oh man, that's like 2013 internet.
Right.
Go back in time. Get on Tumblr.
But seriously, it's trying to ascertain what level of knowledge other people have can be really difficult, especially when you remember that actually when it comes to science, most people stopped doing science when they were teenagers, young teenagers as well. If you only end up doing one science in school once you've chosen your subjects, you'll probably finish doing any of the 3 sciences at the age of like maybe 15 or so, which is a long time ago for a lot of people. And a lot of things have changed over that time. And also that level of knowledge is not very deep at all. So it's interesting that the level of scientific understanding that most people have and trying to view the world through that lens, because a lot of things make a lot more sense when you realize that most people don't have much science or media literacy either, because it's just not taught.
Including the Prime Minister.
Yeah. So back to alien hands. We've got 3 different kinds of alien hands. We've got posterior, anterior, and colossal. It's basically just the different parts of the brain where they're sort of lesions, or where the sort of the problems are happening. Yeah, the faults are. And there are slight differences in them. The frontal form usually affects the dominant, the right hand, and it's characterized by impulsive groping, compulsive manipulation of objects, and difficulty releasing objects when they're grasped. You can also have leg or arm weakness, non-fluent speech, and other sort of things going on there as well. The colossal variant, that is the one that we've probably spoken about more often. That exclusively affects the non-dominant hand, the left hand, in right-handed patients. And you have minimal limb weakness, and you don't have the sort of the features that you'd usually have in the frontal form. But essentially, you that's the one where you don't recognize your hand, you can't write as well, and it does its own thing. All of those. We've spoken about the Colossal Variant. That's the one that we'd most likely be talking about.
I wonder if there's some reason why the dominant one has one effect and the non-dominant one has a different effect where like it's not recognized, but it's not as strong of like out of control.
These are there are outliers to these, obviously.
Yeah.
These are just broad categories, and I think it's based on the part of your brain that's affected, right?
Yeah,
Because the
no,
corpus
I'm
callosum is that area of the brain where a lot of information transfer happens between the two hemispheres, but it's not the only place that information transfer happens.
I'm just fascinated about what might mean that if it happens in the dominant hand, then you're less likely, say, for example, to not recognize it, to not recognize it. Whereas if it happens in the non-dominant, so like, does that say anything about like where, like your concept of self happens?
Proprioception, it would really be.
Yeah.
Where your arm...
What hemisphere that happens in, I mean, yeah.
Yeah, so I mean, proprioception is the sense of knowing where your body is in space. So let's just close your eyes, both of you.
Yep.
Now, place your left arm out in front of you.
Yep.
How are you able to really like do that?
Proprioception.
Okay, now here's another thing. Now that your left arm is out in front of you, keep it out in front of you.
Mm-hmm.
Now, what I'd like you to do is take your right arm and just touch the tip of your middle finger.
Yeah, easy.
Yep. Okay, Jamp, you missed, but
I missed. I got that.
but you touch the tip of... Okay, you can open your eyes. You touch the tip of your index finger. That's fine. So how are you able to do that without seeing?
Proprioception,
right?
Know where everything is.
Yeah, it's the sense of knowing where your body is in space. And it seems like a silly one. It's like, oh, why would I need that? But I think you could... I don't know if you've had this. You might lose proprioception every now and then. I've lost proprioception, like really briefly. As in like, you think your arm is one place and then it's not.
Oh, that's freaky.
You ever had that?
No.
Like, I mean, honestly, the slightest thing, like you feel like your arm is slightly to the left of where it is or something.
I sometimes get it when I'm walking where I can't figure out how far the floor is away. And so I'm walking and sometimes it feels like my legs go too far and they go into the floor. But
come down a step. And
kind of like that.
Yeah. And I mean, actually as well, probably, there's all those things that you do as kids where like, you push your hands into each other and things like that. Like all of these different things that affect how your body feels, where it is in space and tricking your brain like that. But without proprioception, life would be quite a bit more difficult. You don't realize how much you use
Honestly.
it. Like if your hands are at your side, you know where your hands are, even though you can't see them.
It's insane how much we just take for granted for like things that we're just like, those are normal parts of life. Like, you know where stuff is. And like, you get a pretty good, accurate representation of the world from your eyes. And then just like little basic, it's like when we were talking about sight in a previous episode or in a clip, I can't remember, where we're talking about how, it was in Jamp's story in one of the live shows about how someone who was blind had been able to see a little bit and they could recognize like doors and crossings. And I would think about sight as being like, the ability to read, the ability to watch television. And actually the more important stuff is like, am I about to walk into a wall? Where's the door?
How far is that away?
When you think about how sight developed, I mean, initially there were just sort of like light sensitive patches on the surface of whatever organism that first developed it.
Isn't it like algae or something?
Something like that. Yeah. So the thing is that, and all they were able to sense was like more light and less light. So light and darkness. So for like a prey animal, for sort of light sensing prey animals would have been able to be like, so let's say the first sort of light sensing, say predator animals would be able to sense where there's lots of light or less light or whatever, and that might make it easier for them to catch the prey, right?
If they hang out in hot areas.
So if let's say they were in water, right, and if there was less light above them, that meant that some prey was swimming above them, so they could go and get it, right? And now if you're a prey animal, now that there's predators that have light sensitivity, you could have light sensitivity and move into areas of darkness where it's harder to see you.
Yeah.
Sort of those sort of things. So really, at the most basic level, you just need to, you don't necessarily need to be able to see color or all of these different things or a lot of fine detail to get by. You could just need to see basic shapes, understand when something is coming at you, understand how to navigate around the world. You don't need, like you said, the sort of finest of fine details. It's really interesting. right? Like hearing as well. I mean, obviously we need all of this to communicate in the way that we do, but hearing doesn't necessarily need to be super fine tuned. You just need to. All of this stuff just needs to. At the most basic level, just needs to exist well enough for you to not die before you can procreate.
Yeah.
It's really weird. And there's also the posterior variant, which affects the non-dominant hand most often, and that one is associated with really strong feelings of detachment from your limb, and there's less complex motor activity, which means your limb can sort of lift up and stuff, but it's not necessarily going to be tying shoelaces and doing all the complex things that that your limbs can normally do. And those are the three sort of variants. I mean, you could look into this more if you want, but it's all fairly complicated stuff.
Jumping back, that first one especially, the frontal, that seems especially sort of debilitating in terms of like you're going to struggle to go out if you've got no control over one of your hands.
Yeah. I mean, like, this is the thing. Usually it most commonly affects your non-dominant hand or the left hand. This is the thing. In this study in this sort of review that I was looking at, it said non-dominant and in the brackets left. Does that mean that it's always the left or it's always the non-dominant? That's not clear. But in most cases, your non-dominant would be your left.
Had enough of this right-handed normativity.
I'm fine with it.
Of course you are.
It may also
privilege.
It might also affect the limbs as well. So usually, the sort of when the symptoms onset, all of this stuff depends on kind of how you get it, because there are different causes, as I've said. But you could have sudden onset when it comes to strokes. You could have sort of slower onset when it comes to neurodegenerative disorders, and when it comes to the sort of surgery as well, that would be slightly more sudden onset. But most of these, and apart from also there could be sort of shorter term variants that come about due to metabolic issues, multiple sclerosis. Yep. Or strokes. And it usually affects middle-aged to older adults, but there have been some cases of kids having it when they've had a specific syndrome, or in this, actually, it's there is one case that's been recorded with this specific syndrome, Parry Romberg syndrome. And it says as well, the patient may have an emotional response to the AHS. They may express self-criticism, frustration, and annoyance with the limb. They may hit it, admonish it, or personify it as mischievous.
Can you like train the other limb? Can you like a puppy? You can like start like if you slap it, does it like calm down a bit? Not that puppies do that, and not that you should do that to puppies. But I mean, like, can you be like? Is there any way to sort of train it and get it on side?
Give it a treat.
I have not found a study that has looked into the training of alien limbs.
Take it on a walk.
Unfortunately.
I have a question, by the way.
Yeah.
Sorry, no pun intended. I'm going to go out on a limb here. That's actually how I thought about it.
Very good.
Was this similar to, I believe it was sort of multiple personality that we were talking about weeks ago, a condition whereby in the early days, it was considered by doctors to be something that the person was making up?
I haven't found evidence of that.
Because it does seem like you're making this up. You're just pretending.
Yes, but then also why? I think with multiple personalities, it makes more sense to pretend that, because it can get you out of consequences for what you do.
Right.
Whereas if you've got a hand that's what's the point of trying to choke yourself, you know? Oh no, my hand's trying to like.
Probably look genuinely
I just
terrified
mean like
as well.
it might not be targeted towards you. It might be particularly violent as a hand or something.
Yeah.
And then you're like, oh, it was my. Like, imagine if you like beat someone up and then you're like go into the police station and go, I'm sorry, it was my right hand and I don't have control over it. They'd be like, what?
Yeah, but usually you're stopping your hand, and also beating up isn't. I've not really heard cases of the hands necessarily beating people up. Like they can try and attack the host, the person who owns the arm. Yeah. But I've not really seen any cases of them attacking others. It could be the case.
Oh, is it mostly targeted out inwards?
No, don't take that from what I've said.
Okay.
I'm just saying I haven't read that.
Okay.
Yeah.
Well, you mentioned there was like groping and stuff.
Yeah.
Is that of the self or of others?
No, as in groping, as in you can grope anything.
Oh, grabbing things.
Yeah, groping.
Right, okay.
Yeah.
All right, I've never heard that described like that. Just
Yeah,
gonna grope my phone.
No. Well, you grope a person because you. In the
No,
same way
I
you can grope
understand that.
anything.
It's just not a use of the word I'd ever heard of.
Well, look,
It
maybe you
has
should
a
spend less
composition.
time. Maybe you should spend less time thinking about groping people and spend more time thinking about groping objects. Okay.
Sorry.
Groping implies intent.
So the most common cause in sort of early cases were stroke and were strokes. And then, and also I think strokes and the surgery that they were doing. But that kind of surgery has decreased, and there's sort of more understanding of alien hand syndrome now. So now the most common cases are strokes and neurodegenerative diseases. And the issue with the neurodegenerative diseases is that they don't get better because your brain is degrading essentially. So if that starts, there's a good chance that it will continue. Whereas with strokes, you can show improvement, and that's the case with a lot of things that happen with strokes. You can show some improvement over time, and I think with the surgeries as well, I think there was improvement over time. It would only last a few months or so.
Yeah.
It's not like oh no, now my hand will never listen to me ever again. It's my hand's not listening, and then your brain can kind of rewire itself. Yeah.
Maybe it's something you can practice as well.
Maybe, yeah. Maybe you can train your hand like a little puppy. Put a little collar on it.
Practicing trying to move it is different to like punishing it for doing things wrong.
Yeah, so on the largest study to date, which is 150 people involved, they had to convert. They basically, I think it was a neurodegenerative disorder that was the most common case, and then there were strokes, and then other neurodegenerative disorders, and then more things going on. Some people had tumors, things like that. But again, this is not something that's very common. So the studies on it it's very difficult to kind of ascertain what is sort of just random error in these studies and what is like an actual sort of trend, because there aren't very many people that it affects. But we do think that sort of neurodegenerative disorders are the leading cause, and then strokes, and then all of that afterwards. And I want to tell you a little bit about the corpus callosum. You guys know about the corpus callosum?
Indeed.
Please do tell.
No, I mean, what do you know about the corpus callosum?
It's a tightly packed little thing of fibers that connect the left and right hemispheres. As the main data highway, it's described as, between transferring information from the brain, which is helpful because you have some tasks that happen in one hemisphere and not in the other, and they need to share that information.
They have to talk to each other.
Yeah, I mean, that's pretty spot on. I don't
up.
really need to add much to that. I mean, there's about 200 million, it says heavily myelinated nerve fibers, essentially very sort of insulated nerve fibers.
Right. So they don't cross talk.
Yeah, running through that that's what the corpus callosum is made up, about 200 million really insulated nerve fibers. And when you're sort of a baby, the corpus callosum grows really, really quickly. It grows a lot, and then that's because you have more sort of brain cells growing. You've got lots of brain cells growing. You've got those brain cells becoming wider, and the sort of insulation on them becomes wider as well. Although when you start to develop after that, so by the time you get to the age of 4, your corpus callosum has mostly finished developing, but it still continues to grow until you're about I think you're in your 20s, but it does so at a very slow rate.
Right.
Yeah.
I've read before, I think it's probably in my research about corpus callosum from the Split Brains episode, that I think cannabis can have a very bad effect on the corpus callosum. Did you see anything about that?
I did not. No.
Yeah.
No.
Just a warning. If you like your corpus callosum.
Well, no,
Be warned.
that is true though. You probably shouldn't smoke marijuana until your brain is finished developing when you're about 25.
Yes.
Yeah.
Yeah, it's not good, especially in your early years.
Heavy use can really, especially if you're a teenager as well, heavy use can really, really, really affect it. But obviously, if you want to after that point, go ahead. But before that, maybe tone it down a bit.
Check your local laws in your area.
I mean, you probably don't need to check your local laws. You know if it's legal or not.
Check your local laws.
So we know that, as Luke said, that the main function of the corpus callosum is to basically transfer information between both of your hemispheres, and that is essentially that is for sensory, motor, and high-level cognitive signals. So sensing stuff, moving stuff, and thinking stuff.
Yeah.
Yeah. And we've started to learn a lot more about the corpus callosum because we've actually started studying it. And specifically, we've studied colostomy patients, not to be confused with colostomy patients.
Or colonoscopy patients.
Yeah, or colonoscopy patients. Although you can't, I doubt you're going to get a colonoscopy if you've had a
Colostomy?
colostomy.
I don't know what a colostomy is, so please enlighten me.
Removal of the colon.
Oh, okay. Yeah, probably
So
not
there's
then.
Calostomy.
Yep.
And colostomy.
Cool.
We're talking about calostomy, which is the brain one.
Yep.
Good. Yeah. So we've done a lot more studying on it, and we're getting to know more about it. But yeah, we're still studying it. It's the brain. We do know that the corpus callosum has an inhibitory effect, and usually prevents alien hand syndrome and uncoordinated hand motor behavior. So what that means is usually if you've got an intact corpus callosum, you're probably not going to have alien hand syndrome, and you're going to be able to coordinate your hand movements better. So it's interesting because with alien hand syndrome, it kind of points to this idea that the corpus callosum, being that sort of highway for information, is what sort of lets your body know what both hands are doing and be able to coordinate their movement sort of effectively. Yeah.
Mm-hmm.
And when it comes to treatment, do you guys think what kind of treatment do you think there is for this sort of thing?
Oh gosh. Does the treatment actually involve you getting control of your hand back? Or
Yeah. To an extent,
really?
Yeah.
Oh wow.
Yeah. So there's botulinum toxin. Do you know what that is?
No.
You guys know what this is. I know you know what this is.
Botulism toxin.
Botulinum toxin.
Is that
No.
as in a toxin?
It's Botox.
What?
Ah.
Yeah. I don't necessarily know exactly how they use it, but I know that they use botulinum toxin, which causes muscles to kind of like tighten and constrict, which is why when you inject it into someone's face, suddenly all those wrinkles that they've got get sort of pulled out. And why as well, if people have got a lot of Botox, you try and see them smile and their face just doesn't move.
Where do they inject this Botox? In the arm or in the brain?
It's, to be honest, I have read that they use Botox. They use Botox for it. I've not found any. This is something that is usually when it comes to sort of treatments, it's quite easy to find out what the sort of treatment plan is and how they use it because it happens to a lot of people. In this, it's just a case of they use Botox. So I don't know exactly where they sort of inject it into. It might be into the arm to stop the random movements.
Yeah.
Who knows? Maybe that's something we can look
Always
into.
tensed. Can't move as much.
Yeah, just till the dick can't move anymore.
Always flexing.
Yeah. There's also mirror box therapy, which is really interesting.
Oh,
yeah.
Do you observe yourself?
So no, this mirror box therapy basically it's about it. They use it for sort of rehab essentially, where you move your normal arm in front of a mirror, and that hides the other arm from view. Right.
Right.
So
so the mirror is down your center.
Yeah. So you're looking into the mirror, and you're sort of moving your normal arm, and it looks like you're also moving the other arm.
Yeah.
Which I guess somehow you start perceiving that arm that you're so the arm in the reflection as your arm, and you can sort of basically switch the movement that you've got on the arm in the mirror to the arm to the alien arm.
That's especially interesting because of the fact that the way that either the corpus callosum or the way that the brain hemispheres works is it's not that your right hemisphere gets your left eye and your left hemisphere gets your right eye. It's that your right hemisphere gets your left half visual field of both eyes, and your left hemisphere gets your right half visual field of both eyes. So both hemispheres can see out of both eyes, just only part of both eyes. So if you're trying to hide like the sort of, for example, the hand that's not, you don't have control of and look into a mirror, the other hemisphere will still be seeing that so from the
not necessarily down the middle of your body. It's it's to hide your arm, right?
Right.
So it's more probably on the left hand side of your face. Your left hand. So the idea is essentially you're moving this arm.
Yeah.
And you look in the mirror.
Okay.
And you see.
So it's
see. No, not down. No, not down. Not straight down the middle. it's essentially just to hide the other arm from view.
Okay.
Right.
And when you're looking at it, when you're moving, say, the arm that you have control of, and you look in the mirror, it looks like you're moving the other arm, right?
Yeah.
And your brain can then map that movement onto the alien hand and kind of start to regain some control. This is interesting. You might have seen this on QI.
Right.
They did this thing where essentially if you sort of hide your arm, right?
Yep.
And you have like a fake hand put in front of you.
Yeah. And
You can stroke it with a feather,
Yes.
and
Yeah.
your brain starts to feel it, essentially.
I've seen a
But you
video where they
stroke
end up
both.
stabbing.
You
the
stroke,
hand, don't they?
you stroke both hands with a feather.
No, you stroke a fake hand and the real hand.
Yeah.
And then
Oh, that's what I mean by
Yeah.
both hands. Yeah.
So you have a fake hand. Say, for example, you're doing this to your left hand. You have a fake left hand,
Right.
and then your real hand is behind a wall, and you're stroking both the fake hand and the left hand. And you start to associate your sensory information with the fake hand because you're feeling
'Cause you can see
stroking feeling from the real left hand, and you're seeing it with a fake left hand. So then if you stab the fake left hand, you get scared because you have, even though you consciously know it's not, your subconscious brain, whatever's doing your proprioception, starts to associate that hand as your hand.
Yeah.
It's
Yeah.
freaky.
Very
I've
suddenly.
seen that video because they
Yeah.
suddenly pull out like a fork or something.
Like
don't
they've
they?
suddenly they hit it with a hammer or something
Yeah.
very suddenly. And I'm like,
Yeah.
oh God. And then it doesn't hurt.
But then it also works the other way. If you have the hidden hand, the real hidden hand that is actually theirs, and you do stuff to that hidden hand, like stick a pin in it, you don't feel it because you can't see it happening, and you're so strongly associated. So you just don't. That your brain must just take that information that's coming in, the pain sensory information, and be like, well, there's no source of that.
can't
pain,
see it.
so it's
That's
not
weird. Or
happening.
maybe like completely gone, really.
Yeah, people have been like, they put pins in the
wow.
hand and nothing.
Amazing. That's incredible. Yeah, so it's I guess it's a similar sort of idea behind that where you start to really strongly associate that sort of movement that you know you're doing with that arm,
Yeah.
and it can sort of sort of get your brain back in gear. And that is so it says here that it improves motor behavior and increased motor speed. And it can improve motor learning in corpus callosal lesions. So it's kind of a way of getting your brain to really strengthen that behavior, which is really interesting, I think. But also, they do things that aren't quite treatment, but just sort of dealing with it in some way by making the hand, say, hold something like an umbrella or a cane, or putting it in a glove or something. That can limit the amount that it
The damage
that does its own.
cause.
Well,
Yeah.
no, it limits the amount that it does because it's kind of occupied. Or you can make sort of really relax the muscle, or you can bring it into the visual field of the other part of the brain.
Yeah.
So if you bring it into the visual field, or you try and give it verbal commands, all of these things can potentially sort of limit the decrease the effect of it.
That's really interesting. It's a I don't know if this would be accurate, but that suggests that it can hear.
Well, okay, right. See, this is what we were talking about earlier, where you say it suggests
I
that
apologize.
no. Honestly, it's fine. Where you say it suggests that it can hear. The hand can't do anything. The hand is a hand.
I just mean whatever. If there is some in the way that split brain patients sort of become, the theory goes that they become two separate conscious entities. If this hand has some kind of consciousness on its own and is actually, if it's making these decisions as a separate conscious entity, however rudimentary that consciousness is, if it can respond to, obviously I know we don't understand consciousness, and obviously, but I think this is really cool. I think that the alien hand can hear, and he's like, oh, he's told me to do something. All right, this time. But then you can make friends. Get on side.
Okay,
I believe it, Corey.
right.
Don't shut me down.
No, just so what you're doing there is we're applying it's that anthropomorphization that I talked about before. You're applying consciousness to things that aren't necessarily consciousness. So it's when you say, "Oh, the hand can hear," and what the hand's deciding to do, that the hand isn't deciding to necessarily do anything. You
Might
know.
be, though.
No, I mean in that that's
Tiny
like
little
saying
brain.
we say that say an ant decides to do something, but an ant doesn't necessarily decide to do anything. It's just programmed to do something, right? And in the case of you know what I mean? Like in a lot of cases when say ants do something, they're not sitting in their little ant heads making a decision. Oh, I'm going to do this. They're biologically programmed to do a thing, and then they carry out that action. in the same way that we wouldn't necessarily say that like sort of a few lines of computer code that are programmed to do a specific task decide to do said task. They just execute the code that they've got. And when it comes to the arm, remember we were talking a few weeks ago that the brain, there's a lot going on under the surface of the brain, a lot that the conscious mind isn't aware of. So while we think that we're consciously deciding to do things, it's really, there's a sort of undercurrent in the brain that is making things happen. So while to us it may look, oh, the hand is deciding to undress and all of this and that, it might actually be the case that your dominant hand that you think you've got control over is actually a sort of fully capable of doing all the things that the hand you don't have control over is doing. But with the hand that you do have control over, that you think you do have control over, you just think you're in control of that. If that makes sense.
Completely agree with you. However, that does make your argument there does make two assumptions, which is firstly that consciousness and computation are causally linked, which might not be true. And as in, like the ant, for example, because it has rudimentary computation, doesn't have any conscious experience or very limited. It makes the connection between level of complexity and having a conscious experience, which might be true and might not be true. And secondly, I would say that it makes the assumption that you, the conscious individual, are actually controlling anything when you might just be observing the decision-making process.
I don't make that. It doesn't make that assumption at all. In fact, my whole point is to not make that assumption. So what I'm saying is, you feel like you're controlling your hand, right? But it could very well be the case that you just feel like it. Your actual sort of conscious control is just the experience of feeling like you're controlling the hand, when in actuality you're really not. There's just programs running in your brain. There doesn't need to be a consciousness to perform the actions that your hands perform. But when it comes to the ant, I'm not saying that the ant can't be conscious, but what we observe in ants, what we observe in many things, is that they're basically just executing the code, like more or less executing code, right? And they could have a conscious experience, and they could, as an ant, be thinking, I've decided to do this. But my point is to take that and scale it upwards for a human. Equally so, we could very easily, in a lot of cases, and a lot of times we are, essentially just executing code that we're not aware of. Our consciousness kind of is hidden from our consciousness.
If that were the case, then the sort of normal way that we say, I make a decision, would be if it's actually us observing a decision-making process, that would be no different for us and the hand we have control over and the hand that we don't have control over. If decisions are just being made and the fact that someone is there consciously experiencing it is irrelevant, then those are no different. It's just one can talk and one can't.
Well, yeah. I mean,
the hand might be being controlled by some rudimentary part of the brain or some rudimentary part of the spine system, or that we've lost conscious control over. But assuming there's no conscious control, if that were the case, they're no different. It's just that we think one of them is us and one of them isn't us.
Yeah, no, I think that's totally fair. I think all I want to point out really is the fact that a lot of the times when we talk about split brains, we like the idea of there being two consciousnesses. One of them that is mute, that is unable to talk, and the other one which is us, which is able to talk. But yeah, it's kind of what you said there. All I really want to highlight is that we assume that a consciousness is required for these actions to be carried out, but in actuality, your brain does a lot of stuff without your conscious mind being aware of it. And consciousness isn't necessarily a requirement for an alien hand to do its alien hand business. You know, what's?
I don't want to get on it for too long.
It's okay. I mean, we got time.
Well, I just mean that in that case, if that were the case, what I mean by decide there is the computational process, regardless of consciousness.
Yeah,
so that in that sense, it doesn't matter whether the hand has consciousness. The hand is making a decision. However that process happens, the hand is making the decision in the same way that an ant is making the decision, in the same way that you might be making a decision, regardless of consciousness being present.
Yeah, that's fair enough. I'm not saying that you don't understand what you're saying. What I'm saying is that if we say decide, then anyone listening will hear not decide as in, it's computation. They'll hear decide as in arm consciously
dictating.
Yeah. Might not be the case. But it also might be the case, which would be really sad. Imagine if you were the person who had... No, I just mean not like I mean, I imagine this as a possibility that like you're in some kind, you get a cancer, like you, the fully conscious self with the faculty of both hands gets a cancer or gets some kind of injury to the brain or whatever happens where one of the hands splits off as separate to you. What if you were the you that wasn't the you that was the hand?
It's
that
horrifying,
can't see. It's just trapped in this world, and it's got a little bit of proprioception, and it can maybe has some kind of a little bit about like whatever tiny part of either the brain or the brain stem or whatever is carrying on computing. If it were conscious, like what a horrible. Like, what if you still had access to all your memories and you remembered what life used to be like, and you're just trapped being a hand, and you can kind of feel stuff, and you're just like grabbing around trying to work out what the hell's gone on because you remember what life was like before that.
Yeah.
That's just a nightmare.
I mean, from what I've read, I think
so
the
you
way
just try and like kill yourself or slap yourself or just like because I need this to stop.
Yeah.
It's horrible. What a nightmare world.
But then, wouldn't the hand be able to tell us its issues?
Perhaps, unless it didn't have language faculty. But yeah, like I mean, that would be fascinating to try and get the alien hand to draw something.
Yeah, I mean, God, this is the thing. I don't think we know specifically what is going on. I think from what I've read, from what I've read about how we think brains and consciousness work, what makes sense to me is that the arm is basically executing a subroutine. Or executing subroutines, right? It's it's basically just executing things that it needs to execute. They would normally
strangle myself.
Well, no, like so there's your hand has the capability to strangle yourself, right? It has the capability to do all of these things, and there isn't the sort of conscious control being like, or that higher level of control that's aware of it, that's being like, hey, maybe don't do this.
Which things to do?
Don't do that. Don't do this. It's just kind of like. It's getting some input and it's like, okay, output. It's like, no. But it's like, okay, but output. No. It's like buttoning up. Unbutton. No. It's like the arm doesn't need to be conscious in the same way. That okay, think about this. When you're walking down the street.
Yeah.
How often do you think left foot in front of right foot, foot down? Like you don't think about every single individual muscle movement that is necessary for walking.
Yeah.
In fact, I would argue that you don't need to be consciously aware of walking at all. That's why when you're sleepwalking, exactly. Sleepwalking, you don't need to be conscious of that. You don't need to be conscious really even a lot of the time when you're driving, which is dangerous as hell. I have noticed when I've been driving before that I've started driving home and I'm like, oh God, one, how have I not crashed? And two, how did I get here?
Yeah.
But you don't need to be conscious of a lot of the things that you do. And so when we try to think that, all actions require consciousness, that's when we start saying, the hand is deciding to do this, the hand is deciding to do that. Not in the way that you mean it, but in the sense that there must be some trapped consciousness that is in control of this arm, when really it could just be a case of, this is just what bodies do. And usually when you've got some kind of consciousness, you keep a handle on it and stop it from doing that stuff, and like we don't know. We don't know specifically how it works. There could be some level of consciousness there could not be. But it's alien hands.
Freaky.
Very good.
Very freaky, very interesting, right? But that is the end of this episode, or almost the end of this episode. We still have a quick fire quiz.
Dun 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 dun.
Alien hand edition.
Alien hand edition.
So the quick fire quiz is very easy. It's very normal. It's the same as we do every single week. I will ask one question between the two of you. The first person to buzz in with the correct answer once I've finished asking the question wins. What do you win, Jamp?
Nothing.
That's right. Yeah. He looked a little bit surprised there.
Nothing. No, nothing.
Nothing.
Yeah,
Good.
Still.
So, Luke, what is your buzzer? Jesus. Luke's hand. What is your buzzer? Wow.
Wow.
Jamp, what is your buzzer?
Slap with the other hand. Or being startled that you've just seen your hand.
Very good.
Who's that?
Very good. So my question for you is, what is another name for alien hand syndrome?
Oh wait.
What? What?
Oh my god.
Luke,
oh my god.
Luke has literally said it. And I don't know if you said it out loud. Well, for one thing, you answered before you buzzed.
Wait.
Sorry. Alien hand.
And then you never buzzed.
Ah, good one.
Jam.
Doctor Strangelove something.
Yeah, that's good.
Oh, good one. That's it.
With that, I think it's the end of the episode. But before we go, we'd like to thank all of our patrons with a very special thank you to executive producers Ashley Muller and Finn TZ. And also, thank you for watching. You can find the full references for this episode in the description. Subscribe for new episodes every Sunday, and why not leave us a nice wee comment? You can support the pod at patreon.com/SciGuys, or you can find and contact us at SciGuysPod on Twitter, Facebook, and Instagram, and at SciGuys on TikTok too. Or you can send us an email at sciguyspod@gmail.com.
That's sciguyspod@gmail.com.
SciGuysPod@gmail.com.
You can follow me at NotCore everywhere.
You can follow me at Jampkin everywhere.
You can follow me at Luke Comforth everywhere.
Goodbye.
Goodbye.
Bye.